problem. When we experience a serious illness or injury, one that is life-threatening or potentially fatal, like cancer, heart attack, or stroke, and especially if our condition is critical and we are in pain, we will do or agree to whatever it takes to alleviate our pain and improve our condition, even if the cost is not covered by our health insurance. Like many new therapies and experimental treatments or medical procedures not yet approved by the FDA, as well as fees and charges for special clinics or treatment centers that are not within our healthcare network. What's more, health insurance does not cover extended convalescence or home nursing care or assistance with housekeeping, cooking, and childcare, or the loss of monthly income while the patient recuperates from surgery or struggles through chemotherapy and radiation treatments. But all these expenses can cost tens of thousands of dollars, often over many months of treatment and recovery. So how can we be sure that we have the extra money if and when we need it? With Living Benefits Life Insurance. Living Benefits Life Insurance allows us to take a cash advance against the tax-free death benefit if we have one of the eligible medical conditions. These eligible medical conditions will vary by policy, but might include the diagnosis of a critical illness such as invasive cancer, heart disease, stroke, kidney failure, liver disease, blindness, or paralysis. It might include the need for an organ transplant or life support system, or the ability to perform normal daily living activities such as bathing, dressing, or feeding oneself, or a permanent confinement to a nursing home or hospice care facility, or a terminal illness with less than 24 months to live. Ordinary life insurance will pay a tax-free death benefit to our family when we pass on. But with Living Benefits Life Insurance, a portion of that death benefit can be advanced and paid out to us in cash before we die. Of course, whatever we take out while we are living will reduce the amount left for our dependents when we pass on. But this money is paid directly to us and can be spent however we choose to pay for medical expenses or non-medical expenses. For example, Richard was 48 when he was diagnosed with multiple sclerosis. Over the next few years, his symptoms got worse and conventional treatments were not working for him. Desperate for a cure, Richard learned of an experimental treatment facility halfway across the country with a compelling success rate for early-stage MS patients. However, it was not approved under his health insurance coverage. So Richard took an $80,000 advance from the living benefits provision of his life insurance to pay for the cost of treatment over 6 months, including temporary residence and travel expenses. But this experimental therapy has been successful, and Richard's MS is still in remission. Living Benefits Life Insurance can also help a terminally ill patient like Jerry. At only 39, with a tragic diagnosis of inoperable pancreatic cancer, Jerry was given only 6 months to live. So while he was still healthy enough to enjoy it, Jerry took a $40,000 advance against his Living Benefits Life Insurance and quit his job to spend all his remaining time with his family and friends. Of course, during the last 2 months of his life, Jerry required the services of a private duty nurse, which he paid for with another $20,000 advance against his life insurance. So, because of his Living Benefits Life Insurance, Jerry was able to spend every day of his final months with his wife and children, but without any financial worries, limitations, or restrictions. Living Benefits Life Insurance can give us a financial resource to pay for either medical or non-medical expenses that our health insurance does not cover, or to alleviate any end-of-life financial hardship. Living Benefits Life Insurance can also keep us from going into debt or from needing to ask family and friends for financial assistance. And depending on the eligible medical conditions, many policies do not charge for the living benefits provision unless you use it. So your living benefits can be a cost-free option that you may choose to exercise only if and when you might need it.